All right. Thank you, Madam Chair. I appreciate it. I had something really, really awesome happen yesterday, which was the First Lady came to visit one of the community colleges that serves the congressional district that I represent, Sauk Valley Community College. Also with her was the Secretary of Education. And it leads to what I'm really curious about and what I'm hoping, maybe Dr. McCarthy, I'm going to address this to you, but if anybody else would like to chime in. But one of the labs that we all visited together, along with our governor of Illinois, J.B. Pritzker, was a lab for nurses. And we met this 64-year-old nurse who had been an LPN and was going back to community college so she could get her RN degree. And as we were talking with her, I thought, this is what we need more of. People to maybe advance their degrees in some line of healthcare, or to people to go into this line of work, because the congressional district that I serve is 14 counties, covers the entire northwestern corner of the state of Illinois. But 9 of the counties are provider shortage areas. All right, so 9 of the 14 counties are short on dental care as well as mental health. 11 of the 14 counties are short on primary care providers. So it's clear to me, especially after this visit by the First Lady, that community college can play an incredible role in providing nursing, people coming out of the nursing programs, dental hygienists, and other degrees. So, Dr. McCarthy, why don't I address this to you? But what role should community colleges have in fighting healthcare provider shortages that we're seeing all over this country, especially in rural areas like the one I represent? And probably part 2 of that question is, what more can Congress do to support community college to help address those shortages?
Congresswoman Bustos, thank you for that excellent question. And yes, I couldn't agree more. Community colleges do need to be on the front line of sort of replenishing our healthcare workforce and creating opportunities too for our frontline and essential healthcare workers that have been working so hard and who need that next step in their career. So I would say community colleges are really the workhorse of the healthcare workforce development. They are the primary source of our nursing workforce, and then also all of our frontline healthcare workers. So again, I think targeted investment to help colleges meet this need would be very helpful. Also, targeted investments that include some sort of opportunities to create more partnerships with nursing homes, hospital systems, other kind of clinical settings, because one of the major obstacles for a lot of these colleges in expanding these programs is access to clinical opportunities. So we need to think more about how do we get more clinical opportunities available to community college students, and what sort of incentives and how can we structure an investment that gets those providers of clinical spaces to open those up a little bit more. I'll just say 2 more things quickly. One of the other big challenges that we have is that community colleges also provide a lot of training for our very first step into healthcare jobs. Those are certified nursing assistants and some of the patient technical assistants, patient techs, and farm techs that we've been hearing about. But a lot of students, those jobs, as we've been talking about, pay so little that a lot of students have a difficult time doing just what the person you talked about, the LPN, going back for their RN. So we need to do something about the wages and the of those frontline certified nursing assistants, home health aides, and other sort of frontline healthcare workers who just make too little and are in a lot of economic uncertainty because of it. And then the last thing I'll say too is that what we've been seeing, we've been doing a lot of research on community colleges that take their students all the way to the bachelor's degree. Both the state of Florida and the state of Washington community colleges there do that quite a bit. And that's been a big driver of increasing the share of respiratory therapists, registered nurses at the bachelor degree level, and other healthcare workers. So, I mean, I think thinking about how can we free community colleges up, particularly in rural areas, to bring their healthcare workers from the entry level all the way to the bachelor's degree is something we need to focus on more. Thank you.
Very, very good. Thank you, Dr. McCarthy. I've only got about a half a minute left, so rather than ask a follow-up question that will take a little bit too long, I will yield back the remainder of my time. And again, Madam Chair, thank you very much for hosting this hearing today.